Hi, I'm back again. To conclude my assessment, my head-to-toe assessment of LUVA, I will continue from the assessment I've already begun to continue on to the thorax, followed by the abdomen and the lower extremities. I will start by assessing the posterior thorax. So I will ask the patient, LUVA, can you stand up, please? Yes. And turn around. I will assess her posterior. I will observe her skin for the making sure it's warm, the absence of any abnormalities. I will look for the shape and symmetry, and I will also observe her spine. I'm looking bent forward slowly, as if you're touching your toes. Good. And then stand up again. Good. Her spine is straight, free of any lateral deviation, which is good. We're looking for the absence of scoliosis or any other spinal deformities. I will then palpate her thorax. So if you can do it this way. I will hold my hand about below her ribs here, and I will ask her to take a deep breath. And then let it out slowly. Here I am observing the symmetry, the rise and fall of her chest as she takes a deep breath, and the use of her respiratory muscles, which is good. Next, I am going to auscultate the lungs. A good method for auscultation of the lungs posterior is to have her hunched forward slightly. I will have her take a seat on the stool here. Forward on the tongue so I can properly auscultate the lungs. Now, when locating her lungs, it's important to note that the lungs extend from slightly above the midclavicular line, so about the scapula, right down to about the 7th intercostal space, right around where your bra strap would go. It's important to auscultate in between the ribs in a V fashion, starting from top to bottom. It's also important to note, so on the left lung, there are only 2 lobes. You have a left upper lobe and a left lower lobe. But on the right lobe, and this is to accommodate for the extra space that the heart takes up in the thoracic cavity. On the right side, you have the right upper lobe, the right middle lobe, and then the right lower lobe. And it's much easier to observe the right lower lobe posterior. So, I will begin my auscultation of the lungs. And I'm looking to observe normal lung noises, no adventitious noises. So I want them to sound more breezy and free of any crackles, bronchi, wheezing, any pleural friction rub. So I will begin my auscultation. And I'm going to want to auscultate for a full inspiration, expiration every time. So Luba, can you take a deep breath for me? Good. And again. Good. And another deep breath, Luba. Good. And again. Excellent. Good. Excellent. Now, it's important to note that a lot of elderly people may get fatigued during this process, so you might want to give them an opportunity to rest in between all that exercise. Can be quite exhausting. After I auscultate her posterior thorax, I will then auscultate the lateral thorax. I will ask her to turn to the side, and then lift your arm. I will do this on both sides, but for demonstration purposes, I will only do it on her right side. So I will ask her to take a deep breath. respiratory line in a Z-like fashion. Good. And then, following auscultation of her lateral lungs, I will then assess her anterior thorax in the same fashion that I assessed her posterior thorax. I will observe her skin for any abnormalities. I will look for symmetry, shape, any abnormal palpitations. I will palpate the area like I did for the posterior thorax, and then I will auscultate her lung noises. And while I am observing her anterior thorax, I will also obtain her respiratory rate and observe her breathing, making sure it's not labored. So Lily, can you take it out again and face me? So I will assess the skin, and then, like I said, I will palpate the area, and I will ask you to take a deep breath. And you can feel her diaphragm rise and fall, and then I will auscultate her lungs. Again, the lungs are slightly above the midclavicular line to the 7th intercostal space, and they extend right down and up and around. So I will auscultate her lungs in the intercostal spaces in a Z-like fashion, like I did in the posterior thorax. So, you take a deep breath for me? Good. Now it's important to note too that normally in practice you would do this on the skin, but for demonstration purposes we will do it through the Johnny. Don't want to invade our peers' privacy here. Take another deep breath. And you're going to extend down and continue to auscultate the lungs in a Z-like fashion all the way until about the 7th intercostal space to ensure that you are auscultating the lower lobes of the lung. After auscultation of the lungs and the anterior thorax, I will have the patient lie down so I can assess her heart noises, and apical pulse. So Luba, if you could please lie down for me. And normally we'd have a pillow here. So palpation of the apical pulse is right about the 5th intercostal space midclavicular line. I want to palpate the apical pulse for 60 seconds. And now would also be a good time to gather the respiratory rate. Following palpation of the apical pulse, I will listen for heart noises, and in order to do this, I will start from the base of the heart to the apex, and I will want to be listening for S1 and S2 noises. S1 would be the lub, S2 would be the dub. S3 and 4 aren't something we're going to be looking for, and they're also normally associated with abnormalities. So if you do hear those, you would want to report them to the physician or the primary care provider. So I'll start auscultation of the heart noises from top to bottom, starting with the aortic valve. So what I'm looking for here is, So you're going to be looking for the 2nd intercostal space. On her right side at the center intercostal space, you're going to be auscultating the aortic valve. So I'm going to want to listen to the aortic valve for the whole cardiovascular phase, for the lub dub.
And I'm looking for regularity. I don't want to hear any murmurs or arrhythmias. Now on her left side, at the center, on the left side of the sternum at the second intercostal space, I will look for the pulmonary valve. I will listen for the pulmonary valve. Now at the third intercostal space, mid-clavicular line, I will listen for the mitral valve. And at the fourth intercostal space, I will listen for the tricuspid valve. Following auscultation of the heart and palpation of the apical pulse, it would be a good time to perform a breast exam. I'm not going to do that to Luba here, but it's important to note the importance of monthly self-breast exams to the patient and make sure that they are performing them regularly to prevent any abnormalities and also to be aware of the development of any abnormalities. So following assessment of the thorax, I will move down in systematic function to the abdomen. Now, when assessing the abdomen, I will first inspect the area for any integumentary abnormalities. Symmetry, I want to make sure that there's no distension. The skin is even, coloration is continuous, and before palpation, I will auscultate for bowel noises, and I will do this starting in the lower